A tummy tuck procedure or an abdominoplasty is one of the more common plastic surgery procedures that I perform. A tummy tuck is a body contouring procedure. It's not actually weight loss surgery. The ideal candidate for a tummy tuck is someone who's already lost their weight, and so they've obtained an ideal weight that they can maintain comfortably with time. If, after they've obtained an ideal weight, they have excess skin and fat in the lower abdomen in particular, they would be a good candidate for a tummy tuck. Some patients have problems with excess skin and fat in the lower tummy. They can have a rash in the fold, and they would benefit from having that extra skin and fat removed. The way I perform a tummy tuck is that it's a surgical procedure done under a general anaesthetic. Patients do need to be in hospital for a few days after the surgery. The surgery involves removing an ellipse of skin from the lower part of the tummy to the level of the belly button. We make a new hole for the belly button and we remove excess skin and fat. We essentially remove a roll of fat from the lower part of the tummy. At the same time as I remove that excess skin and fat, I also perform a lot of liposuction from the flanks and from the front of the abdomen, so that after the surgery, when the patient wakes up and they first see their tummy, they're obviously delighted with the improved contour, but over the subsequent months, they'll be even happier as the swelling goes down from the liposuction, and they can see the improved silhouette they get in the waist and upper tummy area as a result of the liposuction that's performed. With a tummy tuck or an abdominoplasty, the main thing that patients notice is they lose that roll of excess skin and fat in the lower part of the tummy. Their tummy looks and feels tighter, and the overall silhouette of their abdomen is significantly improved. Recovery from the surgery is different for different patients. Most of my patients are in hospital for anywhere between 2 and 4 days after the surgery. There are drains which are placed in the lower part of the tummy, and those drains come out after a few days. The patients have to wear a binder. A binder is like a corset that goes around the tummy and does up in the front with Velcro. They wear the binder day and night for 4 weeks after the surgery. They can take the binder off to shower. It's important after a tummy tuck procedure that the patient can't do any lifting, nothing heavier than 3 litres of milk, for 4 weeks after the surgery. All the stitches are dissolving, so no stitches need to be removed. The dressings just stay on and are very easy to manage. The patients can shower over their dressings. In terms of time off work, I advise patients to have a good 2 to 3 weeks off. They can't lift anything heavier than 3 litres of milk for 4 weeks after the surgery. Even though they're only in hospital for a few days, I tell them just to take it really easy for that first week or two. Things like driving is different for different people. Some people are able to drive after a week, some people need 2 weeks before they're safely driving a car again.